also died. In my opinion, far more than possibly could be killed by COVID. When COVID struck, I was writing a chapter about the impact of social dislocation and psychosocial stress on health, and I had someone shout, "Get a life." Yeah. This is massively important and driven in large part by poverty. Some years ago, the World Health Organization under Professor Michael Marmot looked at two areas of Glasgow, Calton and Lindsay. One was poor, the other rich. The difference in life expectancy for men at that time was 28 years. The third of a lifetime wiped out by poverty, by economics, not by an asteroid. Yes, poverty kills, it grinds people down and destroys their lives. I was also looking at the Soviet Union after the breakdown in the 1980s. And it's estimated that life expectancy in Russia, looking at Russia, fell by 7 years over a 2-year period. It's estimated that 5 million Russian men died as a result of the economic shocks. An equivalent death rate for the entire world would be 200 million people. So what do you think of that, COVID? You're never going to get close to that figure. But the idea that we're in some zero-sum game where every life lost from COVID is going to be one that would have otherwise saved is utter nonsense. Poverty kills more people than COVID ever could or will ever. In the West, this may not end up as a disaster. We have a big, plump economic air cushion to fall into, although the air is now leaking out rapidly. Even in the West, bad things are happening. I was reading an American doctor blogging about the fact that he was seeing more patients being admitted to his hospital suffering from starvation. And we also know domestic abuse has risen rapidly. As always, most of this remains hidden. It's an iceberg, but children are already suffering. Women are suffering, trapped in their own homes, with parents, men mostly, sadly. Angry, frustrated men, men unable to articulate their needs, violent men. Men often abused when they're younger and playing out the terrible repeating pattern of their lives. These men are now losing their jobs, their purpose. There's only going to be one ending here. What of the developing world? You know, we're okay here for the moment. David Beasley, who's the head of the United Nations World Food Programme, told the United Nations Security Council that the world is on the brink of a hunger pandemic. Globally, 135 million people are facing acute food shortages, and the coronavirus could increase this by another 130 million. In the worst case scenario, we could be looking at famine in about 36 countries. Famine. Can you imagine how many people will die as a result of that? As a result of the actions we have taken against COVID. Somehow we become blind to these costs. We see only COVID. 10 deaths from COVID hits the headlines on the news, and the total figure ticks up inexorably on the dreaded death counter on BBC News. 10 deaths, 20 deaths. The death counter ticks up again. You probably counting how many pages I've got. Hold on. It's all right, I've lost a couple, so we're okay. But this is simply nothing. Around 1,700 people die in the UK each and every day. And 10 deaths is the lead item on the news. Far more people have died of cancer or heart disease since the start of COVID than have died of COVID. Far more of these things, we hear nothing. In fact, they've begun to stop frightening us with COVID deaths. We now have moved on to COVID cases. Why, I suspect because there are far more of them to scare us with. COVID deaths, COVID cases, if we were not testing hundreds of thousands a week, we would not know that this disease was still here. The overall death rate, that is the death from all causes, is now lower than average. Fewer people died in June, July and August than is normal for this time of year. We should be celebrating this. Hooray, today 50 fewer people died than normally die. Hurrah! Instead, it's 10 from COVID and 12 on Tuesday, and I think someone said we've become trapped in some weird COVID death cult. It's very disturbing, but enough of that. I want to talk about the most important issue. Will we kill more people with lockdown than we are saving? Well, it's very difficult to work this out. I mean, there's people who are not being treated, people with heart attacks not being treated, the elderly population thrown under a bus, Now, I've worked in care homes. I have been in care homes since the start of this lockdown as a doctor, by the way. 36 patients that I have dealt with died of COVID, by the way. So I don't believe it doesn't exist.
Was it COVID or Corona?
Good question. Well, I put COVID on the death certificate, but I was just guessing. And the hospitals were cleared out. Half of all the excess deaths have been in care home residents. 20,000 by May. This is, I'm talking about the UK. Vulnerable people who must have been protected, not thrown to the wolves. There was also the long-term failure to detect and treat early-stage cancers, the pacemakers not fitting, or, as my daughter told me, she just started as a doctor, pacemakers running out of batteries because people were too frightened to come to hospital. The misdiagnoses, the depression and anxiety. I just read a paper stating that suicides have exploded in number. No surprise there. The well-off like me, with large gardens and secure jobs, have hardly been affected. Lockdown, for some, has been a little holiday from life. I do a bit of acting here. Really, I don't know what people are so upset about, Tamsin. I've learned to make sourdough bread and completely sorted out the spare bedrooms. Oh, I'm finished yet. Little Euripides has had such fun in the orchard, I really don't want it to end. Thank you. Alternatively, you can drive 280 miles to your parents' estate in Northumbria so that Mummy and Daddy can look after the kids. Not so easy for those in the gig economy, those working in hospitality and low wages, stuck in an airless flat with 5 others, parks firmly shut. Anyway, getting back on track. The first question, and this is the bit that gets boring. I bored myself. How many people would have died from COVID if we hadn't locked down? I asked this question. It's really impossible to be certain that we did more harm than good if we don't know how much good we may, I say may, have done. Can we ever answer this question? It's tricky. To try and answer it, we go back to the very beginning and find out what was the science behind it all, because according to Boris, we must follow the science. Instead of a big boy made me do it, Boris now pleads, the science made me do it. It wasn't my fault, can't blame me. In Scotland, of course, Nicola has a different science. The science in Edinburgh. I thought everyone in Scotland loved Nicola. Oh well. I think I was wrong. Anyway, she says that in Scotland you must do everything about a week before or after England does it. Maybe she invented a time machine. No. Now that would be science. But getting back on track, when you strip everything else apart, the reason for lockdown comes from a figure of 1%. That is the prediction that COVID, if left unchecked, would kill around 1% of the population. You might not think that figure is enormous, but 1% of the population of the world is 70 million. 1% of the population of the United Kingdom is 670,000, and 1% of the population of Scotland is 55,000. That is a lot. But where did this 1% figure come from? And like most unpleasant figures currently, it came from the US. That was a joke, by the way. Where did the US get the 1% figure from? Now, you might find this impossible to believe, but this figure emerged by mistake. Yes, it was a mistake. It's a pretty major thing to get wrong. I'm going to skip over a bit here because somebody else is going to talk about it.
0.1%.
With COVID, one type of fatality rate was substituted for another. The wrong rate was then used to predict the likely death rate, and no one picked up on this error. In order to understand what happened in a compounded mistake, you have to understand the difference between two things that sound almost the same but are completely different. Sorry, I might lose a few people here, but it's a nice day and we're having a nice time. First, there is the infection fatality rate. That is the total number of people who are infected by a disease who then die. This figure includes people who have no symptoms at all or any very mild symptoms. Those who stay at home and coughed a bit and watched Outbreak and then cowered under the covers for 6 months. Then there is the case fatality rate. That's the number of people suffering serious symptoms, the cases. This would normally be people ill enough to end up in hospital. Now clearly people who are seriously ill, the cases, are going to have a higher mortality rate than the total population who are infected, many of whom don't even know they are infected. Putting this simply, all cases are infections, but not all infections are cases. So the case fatality rate will always be far higher than the infection fatality rate. And with influenza, the case fatality is about 10 times the infection fatality, probably more in truth. Are you following me? Yes? Now clearly you don't want to get these figures mixed up, because you could either wildly overestimate or wildly overestimate, did I say overestimate, the impact of COVID, but these figures got mixed up. I'll take you through this as slowly as I can. It's mainly so I can understand it. But this error comes from the US, but I want you to remember that in healthcare, the US is very much the dog that wags the tail. What they say is taken up around the world. Their figures are used around the world, and they have been. So let me take you back in time to February the 28th, 2020, before the lockdown. This was when an editorial was released. This is a bit of a mouthful. With the National Institute of Allergy and Infectious Diseases and the Centers for Disease Control and Prevention in America, the big guns. It was published in the New England Journal of Medicine, the highest impact medical journal in the world. The editorial stated, remember this is February the 28th, and this was written by Fauci. But he's my hero. The overall clinical consequences of COVID may be ultimately more akin to that of a severe seasonal influenza. 28th February 2020. But in that editorial they added that influenza has a maximum case fatality rate of approximately 0.1%, 1 in 1,000 maximum. But that quoted case fatality rate was completely wrong. It is at least 10 times too low. They meant to say the infection fatality rate was 0.1%. So on the 28th of February, all the experts, including Fauci, the high priest of COVID, stated that COVID is likely to end up much the same as a severe influenza epidemic. Clever guys, they got it right. But that fundamental mistake was baked in. They got the CFR, the case fatality, and influenza fatality rate mixed up. This mistake was then baked into the figures. And on the 11th of March, a few days later, the same experts provided testimony to the US Congress on the potential risk of COVID. At this meeting, Congress was informed that the case fatality rate for COVID was likely to end up at about 1%, which, as time has passed, seems to be quite accurate. At this same meeting, they compared the likely impact of COVID to influenza, but here they used the wrong figure for influenza. They used 0.1, the one that is 10 times too low. So when they compared the 1% case fatality of COVID to the 1% case fatality of influenza, this is when everything changed. Suddenly, COVID was going to be 10 times as deadly as the worst influenza. Now, I hope that's clear. What happened? So if influenza killed 50, COVID was going to kill 500. If influenza killed 1 million, COVID was going to kill 10 million. There's no wonder Congress and the rest of the world panicked. They could see 2.5 million deaths in the US alone. Nearly 1% of the entire population of the entire world, 70 million. Now I don't expect you or I to get this right, but I do expect the experts to do so. They did not. The CDC, the NEGM, the National Institute of Allergy, and whatever else it's called, and Fauci. Brave. I just need to say Fauci. Fauci! Nicola! Fauci, Nicola, Fauci, Nicola. And now I'm quoting, this isn't just me saying this, by the way. Cambridge University Press published a paper. Public health lessons learned from the biases in coronavirus mortality. Sorry. I said Fauci too many times. On March the 11th, the US Congress House Oversight Committee was informed by the National Institute of whoever they are. Based on the data available at the time, Congress was informed the estimated mortality rate for coronavirus was 10 times higher than for seasonal influenza. which helped launch a campaign of social distancing, organisational and business lockdowns and shelter-in-place orders. So at the risk of repeating myself to death, on February the 28th, it was estimated COVID was going to have about the same impact as a bad influenza season. Correct. 11 days later, the same group of experts predicted the mortality rate was going to be 10 times as high. This was horribly, catastrophically wrong. One of the UK, here we get to a group I call the mad modelers of lockdown, the Imperial College modelling experts. They definitely get a lot of booze, I think. They managed to create exactly the same panic here. On the 16th of March, 5 days after the US Congress hearings, they used an estimated infection fatality rate of very nearly 1%. In fact, they estimated 0.9%, 9 in 100, not 10 in 100. I don't know where this small difference came from. That 0.9 figure is why Imperial College predicted that without lockdown, COVID would kill 500,000 people in the UK. That is, if 80% of the population was infected, which was just a guess, by the way. So is this prediction anywhere near being close? Well, we've had officially somewhere in the region of 40,000 deaths from COVID in the UK, which is not that far off 1 in 1,000, or 0.1%. Of course, people will say we had lockdown. Without lockdown, so many more would have died. More people would have been infected, etc., etc. I mean, there are people who are desperate to talk about how terrible and serious COVID is. I mean, they seem really desperate. To answer this, we want to know what the true infection fatality rate might be. Is it 0.1% or a full 1%? If it's 1%, we have more than 400,000 deaths to go in the UK. If it's 0.1%, the epidemic has finished. So what are countries that did not lock down, such as Sweden? They had moderate lockdown or no real lockdown at all. They never closed the schools, they allowed groups of 50 to meet up. Restaurants and bars stayed open, people stayed at work. Their economy was largely protected, although of course if you're surrounded by other lockdown countries, you're not going to be 100% successful. The population of Sweden is 10 million and their deaths have topped out at 5,800. That death rate is about half of ours, although we locked down. They opened up further and further in July and August, so what happened? Deaths on the 21st of August, 0. Deaths on the 22nd of August, 0. Moving a few days forward, deaths on the 31st of August, 0. Deaths on the 1st of September, 0. In the entire month of August, they've had 60 deaths. It's now running at 1 a day. 1 a day. Match this to their positive swabs, assuming it takes about 14 days from positive swab to death. 7th of August, 380 positive swabs. 8th of August, 269, 9th, 38, 10th, 196. 920 positive swabs for COVID, 0 deaths in any of the days 14 days later. Which, and my maths isn't perfect, but I can work this one out. This is a case fatality rate of 0 and an infection fatality rate of 0. Our current rate in the UK is 7 a day, which is exactly the same as the Swedish 1 a day. But are these people actually dying of COVID, or they just got a diagnosis of COVID? It seems looking around the world, we've got pretty much all the deaths we were ever going to get. If you look at the graphs of death across Europe, you can see this disease has gone. Late March, April, early May, we had a spike. Many other European countries had a spike. Now gone, completely. We then had all those Black Lives Matter marches. What happened? Nothing. We had the madness on the beaches in Bournemouth. What happened? Nothing. Yes, we're testing and finding more so-called cases, as of course you will. But the hospitals are virtually empty. The intensive care units are virtually empty. Almost no one is dying anymore. And most of those dying were otherwise very ill. So instead of celebrating this, we've artificially created a whole new thing to scare ourselves with. We now call a positive test a COVID case. This is not medicine. A case is someone who has symptoms. A case is not someone found to be carrying the virus in their nose. 5 years ago, a friend of mine had a swab and was found to have MRSA in her nose, the antibiotic-resistant bug, the one we used to be scared of. was a bad mistake to have the swab. She volunteered to be a control subject. As a reward, she got 2 weeks off work and antibiotic gel stuffed up her nose every day. Did she have MRSA? No, she did not. Was it affecting her health in any way? No. Did she have symptoms? None. Could she possibly in any way be called a case of MRSA? No, she was an asymptomatic carrier. She was not an MRSA case. Now, however, you get a positive swab for COVID and suddenly you are a case. Never in history has medical terminology been so mangled. Repeat after me, a positive swab is not a case. It's my new slogan. Now, it's catchy. Never have the statistics been so badly mangled. Until recently, you couldn't even recover from a case of COVID in England. Well, that's actually still true. So what happened was you could, and we all know this, you could get a positive swab. A month later, you could be run over by a bus and you'd be recorded as a COVID death. I mean, this is so ridiculous. It's just unbelievably ridiculous. When researchers look back over this pandemic, they'll have absolutely no idea who died of COVID, who died coincidentally with COVID, who died because of COVID, because of lockdown. Everything's been mashed together. Before I wander completely off track, I want to take you back to the main point I started with, which is lockdown happened because we were told that COVID could kill 1% of the population. Now you could agree or disagree with lockdown on that basis. I disagreed with it. But that figure was a mistake. COVID was never going to kill more than 0.1%, about 50,000 max. That's the correct figure. That was the figure estimated on the 28th of February, and it's a figure that's turned out to be remarkably accurate. We've now had our 0.1%. The US has had its 0.1%, as has France and Spain and Italy. But we panicked. We added hugely to our 0.1%. Excess mortality in March, April and May was around 70,000 above the expected rate. And that's not the 40,000 who died of COVID, which means 40,000 died of COVID and at least 30,000 died of the result of the actions we took. We protected the young, the children who are at very nearly zero risk, far less than 1 in a million risk. But we threw our elderly and vulnerable under a bus. The population who should have been shielded were the elderly and vulnerable. Instead, we got 20,000 excess deaths in care homes by May. It was government policy to panic and clear out hospitals and stuff care homes with patients carrying COVID, untested. Even patients known to have COVID were forced back into care homes. Or they were prematurely discharged back into the community, to their own homes, to infect their nearest and dearest, or any community staff who visited them, who then went on to visit other vulnerable people. We did not, to quote Matt Hancock, throw a ring of steel around care homes. We turned them into COVID incubators. We also trapped the residents in them. We ensured they had do not resuscitate forms filled in, just to make sure the ambulance crews would not, absolutely would not, take them into hospital, no matter what was wrong with them.
Genocide!
An elderly person in a care home who was ill that I knew, she stayed there. I had a particularly fierce battle to get her in to hospital. She was unwell, high temperature and such like. When the next day I eventually breached Matt Hancock's ring of steel, she was admitted. She had sepsis. She died. If I'd got her in the day before, she would most likely have lived. There are hundreds, thousands of stories like this. Yes, we got more than 20,000 excess deaths in care homes. 1/3 of all deaths in 1/100th of the population. I know why. Anyone working in them knows why. Government policy killed them. This is far from the end of the damage. Leaving aside care homes, the Office for National Statistics estimated that 16,000 excess deaths were caused as a result of lockdown. That is, so far. The heart attacks and strokes not treated, those who didn't even attend, terrified of COVID. Terrified and trying to protect the NHS. I don't know about you, I work for the NHS and I thought we were there to protect the public. Not the other way around. So we have the empty and echoing accident emergency units, the empty echoing hospitals with staff twiddling their thumbs, the empty echoing Nightingale hospitals with staff twiddling their thumbs, the cancer treatment stopped dead. I think it can be said today, and I've read government reports admitting this, that at least as many people died as a result of the draconian actions taken to combat COVID as have been killed by COVID or ever would Lockdown has been a slow-motion stampede where the elderly in particular were trampled to death. We locked down in fear. We killed tens of thousands unnecessarily in fear. We killed the elderly. We've trapped abused women and children at home with their abusers. We've wiped out entire companies, even industries. We've boosted Amazon through the roof while destroying our high streets. We've stripped out the NHS and left millions in prolonged pain and suffering on ever-lengthening waiting lists. Hundreds of thousands of missed cancer diagnoses, the effects of which are yet to be seen. And our basic human rights have been trampled into the ground. Lockdown has been a complete and utter disaster. It has killed as many as it could ever have saved. And it was based on nonsense, a claim that COVID was going to kill 1% of the population, a claim created by mistake, a claim that can now be seen, mistake or not, to be utterly and completely wrong. It takes a very big person to admit they've made a horrible, terrible mistake. But a horrible, terrible mistake has been made. I call upon the governments of Scotland and the UK to end this ridiculous nonsense. Now, and to vow never to let such monumental stupidity happen ever again.